Dr. Jaffe, do you recommend individuals calculate what they're getting from their food in terms of calcium intake, and then determine their dose of a calcium-containing supplement like PERQUE Bone Guard Forté?
What I recommend is that people check their urine pH regularly and take as much magnesium and choline citrate as it indicates. With regard to calcium intake, you either get enough calcium or you get too much calcium. If you have kidneys, if you ever sweat, if you poop, you regulate your calcium in urine, sweat, and stool. You don't have to calculate calcium. You may be aware that we use about several $1 billion a year of calcium channel blocker medications for high blood pressure. Doesn't that mean we should be measuring calcium? Well, no. The relative excess of calcium and the absolute deficiency of magnesium create the imbalance called high blood pressure. The answer is to restore the magnesium, but that has been very difficult until now. There is a way, combining PERQUE Mag Plus Guard with PERQUE choline citrate, to triple, approximately triple, or more the uptake of magnesium, especially if you have any digestive issues. So pay attention to magnesium. In regard to calcium, the only measure clinically, the only measure routinely available is ionized calcium. If you tell me the total calcium without telling me the protein and a bunch of other things, I don't know what to say. If you want to measure calcium in the clinical lab correctly, measure ionized calcium. And if you want to measure potassium in the clinical lab, don't measure serum potassium, measure plasma potassium. I can tell you as a laboratorian that is true. Most clinicians don't know what I know from the laboratory point of view. So you can pay attention to calcium, and the biologically active calcium is ionized. You can pay attention to potassium, especially if you're measuring plasma potassium. Then you should be measuring serum magnesium. Because if you're in the lower half of the laboratory range for serum magnesium, you have CLMD. You have chronic latent magnesium deficiency as defined by Ron Eileen 15 or more years ago. Multiple studies confirming that if you're in the lower half of the usual lab range for magnesium, you're deficient at the cellular level. And if you're in the upper half of the usual lab range, you're sufficient. And you should celebrate, and you will probably feel better. We've done a study on hypertension, high blood pressure. 100% of the people who qualified for the study were in the lower half of the serum range when they started, and there was a trend, a tendency to show that improvement in serum or even urine magnesium correlated with changes, favorable changes in blood pressure. So we have lots of evidence that magnesium is important, and that while calcium is important, magnesium is more important on a daily basis to be taken along with choline citrate. And then, of course, eat a wide variety of fruits and vegetables. You'll get a wide variety of minerals, including potassium and calcium. Have some nuts and seeds. They're full of good oils and calcium and magnesium. And selenium, if I remember correctly, is in Brazil nuts. So eat a wide variety of nuts and seeds. In fact, eat a wide variety of whole foods, including sea vegetables, seaweed. That gets you iodine and iodide, as well as fiber. So it's a trifecta. So I'm glad you're concerned about minerals. I want you to be concerned about the correct minerals, and I want you to measure them in the correct way.